The Canadian and U.S. governments have closed the border between the two countries to all non-essential traffic.
The coronavirus pandemic has now killed more than 10,000 people.
COVID-19 is more lethal among the elderly and those with underlying medical conditions.
Death toll from COVID-19 in that country now more than 3,400.
A grim milestone. The coronavirus pandemic has now claimed more than 10,000 lives across the world.
A pandemic the likes of which we have never seen before.
What is the coronavirus?
From my understanding,
coronavirus, also known as COVID-19.
I believe that the coronavirus is a virus, and now it's called COVID.
It's a new virus that emerged out of Wuhan, China.
What is the coronavirus?
The coronavirus is a type of viral strain that has been infecting a vast majority of people.
There seems to be some sort of scare around it, I guess.
It has like the same symptoms as a normal cold.
So the coronavirus is an airborne virus.
According to the World Health Organization, the coronavirus disease, or COVID-19, is a new strain belonging to a large family of viruses. These viruses are zoonotic, meaning they are transmitted between animals and people. Common signs of infection include fever, cough, shortness of breath, and breathing difficulty.
How is it transmitted?
I believe that it is transmitted person-to-person contact.
You can get it from like people coughing or sneezing. You can also get it from contact, I'm pretty sure, or ingestion.
Whether that's like sneezing or like if you have sinus and you're touching other people.
I guess through like the air, right? Yeah.
Through the droplet procedure, so the water droplet procedure.
I agree.
The Centers for Disease Control and Prevention believe COVID-19 is spread from person to person through respiratory droplets. These droplets can land in the mouths or noses of people within 6 feet of the source. It is also believed a person can spread the virus without showing symptoms themselves. Another way a person can become infected is by touching a surface or object that has the virus on it and then touching their own mouth, nose, or possibly their eyes.
Is there a treatment for it?
Yes.
There's no like vaccine or anything, but there is treatment for it. Like there's people who have been recovered from the coronavirus.
I mean, I heard that there wasn't like a vaccine for it or anything like that.
There's currently no known treatment.
I don't think so. I don't think there's treatment or a vaccine as of now. And yeah, some people seem to recover and some people just seem to not.
According to the World Health Organization, since the strain of coronavirus is so new and different, there is no vaccine for it. Researchers are trying to develop a vaccine and advise against the use of antibiotics, since they work only on bacteria. However, those infected should receive appropriate care from professionals. This does not mean being infected is a death sentence, since almost 92,000 of the 276,000 people infected recovered, and the vast majority of the cases are considered mild.
What can you do to protect yourself?
To wash your hands and to cover your mouth. So wearing the face masks is a big thing.
I heard that wearing a mask isn't actually that useful, and it's just like if you have it, then you should wear it so that you can't like transmit it. But apparently, just putting it on to protect yourself isn't really.
A mask that I don't have.
Sanitization and like just being cleanly.
Having good hygiene, you know, washing your hands, trying to avoid like unnecessary contact with your surroundings, like hand sanitizer.
Well, you can wash your hands and make sure that you're not spreading bacteria around. Washing hands, hand sanitizing, trying to prevent touching your hands to your face because that's where the most exposed, you're more susceptible to get it.
The WHO recommends using a mask only if you're taking care of a person with suspected COVID-19 infection, or if you're coughing or sneezing. The WHO also provides instructions on how to best use and dispose of a mask on their website who.int. They recommend washing your hands regularly for 20 seconds with soap and water or an alcohol-based hand rub. Cover your nose and mouth with a tissue or flexed elbow when sneezing or coughing. Avoid close contact with people who are unwell and self-isolate if you feel unwell. Don't touch your eyes, nose, or mouth if your hands are dirty.